Hey guys, Woodruff here. Now we're going to talk about carpal tunnel. Um, so this is something that it's another thing nurses would be at risk for, but we're not the highest risk category for this. So it's one thing that we can like check our box that at least we don't. Sometimes we do continuous repetitive activity, but most of the time we're just doing everything. So we usually are changing. We're not doing repetitive like hand movement, repetitive hand movements at least. But it is something that it's possible that we could be at risk for. So let's talk a little bit about it. What it is that we have these, we'll call them tunnels, because that's a carpal tunnel is an actual thing. There's an actual tunnel called your carpal tunnel. And what it is that there's these tunnels. What do you call them? Sorry, my son's being crazy, scratching on the wall. It's if it's not the cats, it's my 5-year-old. So there's always something, right? It's like I think the world comes together. It's like, hey, Woodruff's making a video. All noises commence at once. Everything go to fall apart. So yeah, thanks for listening. Anyway, what happens is that let me back up about the tunnel thing because I think the tunnel thing will confuse you. But effectively, you have nerves that lead into your hand, and the ligaments and the other things around them can sometimes, from repetitive movement, get a little swollen, get irritated, and put pressure on that nerve. So usually this happens for when you think about carpal tunnel. Think about repetitive movement. This is also like considered like a repetitive strain injury. So think about people that do continuous or like very methodical hand motions or hand movement. So that would be people that are like musicians, like someone playing a guitar, carpenters that have to do kind of repetitive hand movements as they're building, putting things together. And if you didn't know this, carpenters don't actually put carpets together because that took me a long time to figure out. So if you're thinking like imagining someone putting a carpet down, a carpenter doesn't actually just work in carpentry, which is it took me a while to learn that if you did not know that. Just a little life lesson because I figure, I mean, if I can put in some cool, fun life facts while we're doing this lecture, why not? But yeah, so people that do continuous wrist movements would also be those that work on computers, or think of people that work like assembly line that are doing the same hand motions. Now, it's not necessarily anyone who does any repetitive movement, but it's anyone who does repetitive hand movements. Um, the heck he's doing over there? It's probably some sort of repetitive hand movement. But anyway, everything's fine here. Everything's fine. But also, the repetitive movement from using a computer, like typing constantly, can also cause you to have the same issues. People can also have it for non-repetitive, like movement issues, like they could have tumors or masses that are pressing on the median nerve. Rheumatoid arthritis or peripheral vascular disease could cause them to be more likely to get carpal tunnel. Diabetes, because diabetes messes with everything, and affects blood vessels. And then women also have a smaller carpal tunnel, if you didn't know, a little fun fact for you there. They're going to be more likely to get carpal tunnel syndrome. So, how do we assess for this and how do we diagnose it? No. So we assess for it because the general symptoms, because think of it this way, carpal tunnel is effectively a blood flow issue. Like it's an issue where there's I don't want to say it's a blood flow issue. It is, but it's a nerve issue. I don't. Let me take that back. It's not a blood flow issue, but it's a nerve issue. And nerves can affect, there's too much pressure on a nerve that goes to your fingers. And so what are your symptoms going to look like? They're going to be discomfortable. Oh my God, I just created a word. Discomfortable. I hope you like it. It's going to be out all the time. And I mean, you first heard it here, but if you want to take it and go own it wherever you're at, you can get discomfortable and talk about it all day long. All right, let me try and back it up. At least I have fun. Uncomfortable, at least a lot of uncomfortable symptoms in the hand. And what you would think, like, your nerves help your body to tell you when you're feeling something or when you're not feeling something. So if there's a lot of pressure on it, it's going to decrease the nerve signals to your fingers, which can lead to a weakness. Like if my nerve's not working, it's not sending electrical signals, so it's not going to work as well. It's also going to possibly cause pain because of the lack of nerve sensation, or the pressure on the nerve can lead to pain. Numbness and tingling, especially, this is very common where they get the numbness and tingling in their hands because of that pressure on that nerve. Again, kind of go back to what we talked about with the neurovascular assessment with the paresthesias. Because when there's pressure on nerves and on blood flow. And again, this is not a blood flow issue, but for both of those, it can definitely lead to that numbness and tingling. So, um, other things that are kind of characteristic of carpal tunnel are going to be when their symptoms occur. A lot of times these patients may complain that their symptoms wake them up at night. You would want to think about why that would happen is because at night, maybe the positions that we're laying in, and then also the decreased cardiac output that happens at night and stuff like that can lead them to have worsening symptoms at night. They may wake up with it. Something else that's very characteristic of carpal tunnel, because of the weakness in their hand, they usually have trouble performing fine motor movements. So it'd be things like picking things up, like think of like the pincher grasp and like kind of like reaching for something and picking it up from a table, like something small. That this kind of bent wrist movement, anything that you're going to have to bend your wrist to pick something up, can be harder. They might be more clumsy with it because they don't have the same strength. And then a lot of times these patients, they're going to feel better if they're starting to feel the numbness, tingling, the pain. If they shake their hands out, they're going to feel it's better. Or if they stop doing the activity, it's going to get better. Now, does that fix their problem? No, but it may give them temporary relief. And then you want to ask them also, like, what happens right before? Do you get these symptoms when you're doing a repetitive task? What are they doing right before? What's their occupation? That's a really important question to ask. Um, so the two diagnostic tests that we can do to look at carpal tunnel is, first we can do what's called Tinel's, or maybe Tennille. Tennille sounds more fun. Tennille sign, which is where you tap on the median nerve. So you tap on it, and then if it starts to elicit any of the symptoms, then what do you call it? Like the weakness, pain, numbness, and tingling. It's usually a positive sign. Um, and then the other one is the phalanx, which is where you put your two hands together and you keep them at flexion for at least 60 seconds. And after that, think phalanx, like the flexing, if you flex them, or you could put them out like this, boom. And so think like the ring finger, like, if you like it, then you should put a ring on it, kind of motion. So if you do that for that at 90 degrees and for greater than 30 seconds, if you start to get the weakness, the pain, the numbness, tingling, it can be a sign of carpal tunnel. You're welcome to pause me now and try to see if you have carpal tunnel if you'd like. So let's do some true or false. So the first one, let's see. So for each of the following statements about carpal tunnel in treatment, specifically treatment, indicate whether it's true or false. So the first one says, after a carpal tunnel release surgery, the priority assessment is a neurovascular assessment. Apparently that should be assessment. So yes. I'm assuming carpal tunnel release surgery is a treatment. So the priority. So let's say that I didn't know anything because we haven't gone into treatments yet. If someone is having a nerve issue that's causing neurovascular symptoms in their hands, and they get a surgery to fix it, what's going to be my priority? I want to see if it's working. So I think, yes, I think true that the priority assessment is going to be a neurovascular assessment. All right, so true for one. Number two, there is adaptive equipment to help decrease symptoms and improve carpal tunnel. So, I mean, that seems to make sense. Maybe there's some splints or something else they can wear to take pressure off of that median nerve. So that sounds pretty reasonable for treatment. I'm going to say true. The main intervention for carpal tunnel is to change occupations or hobbies. Well, I'm sure that could help, but it's pretty extreme. So, I mean, if someone came to me and says, "Hey, when I play my guitar, I have some numbness and tingling," and for me to say, "Yeah, you got to stop playing guitar," that's when it says the main intervention. I don't really like that. I think that's a little too extreme. So, I'm going to say false for that one. Number four, splints only need to be worn while doing repetitive activities. Well, I mean, that seems to kind of make sense if their problem is when they're doing repetitive activities, but since like we talked about it, when they sleep, they can also have issues. It seems like they should wear them all the time. I mean, they're going to need to take some breaks now and again, but the splints probably are going to need to be worn more than just when they're doing repetitive activities. So I'm going to say false. Taking regular breaks from repetitive activities can help to improve symptoms. Well, I'm sure that can. We kind of talked about shaking it out can be helpful. So I'm sure if you stop whatever you're doing, it would, taking breaks is going to help too. It'll decrease the amount of time there's pressure on that nerve. So I'm saying true, true, false, false, true. So let's look more into this. So medical treatments for carpal tunnel, they're going to be focusing on, again, relieving that pressure off the median nerve. We're going to wear splints even at night. Physical therapy can help as well, just to kind of adjust, make sure that they are doing everything they can during that activity that's going to promote less pressure on that nerve. Short term, for the pain, if the pain is severe and they need some help, we can do corticosteroid injections. We'll talk about this a lot with joint stuff, but effectively, steroids, they're anti-inflammatory. So if we have, some sort of inflammation here at the wrist, they can inject steroids into there, and depending on the person, their injuries, it can provide short or more long-term relief from their pain. And then the most invasive medical treatment would be what's called a carpal tunnel release, and that's where like it says here, if there's symptoms are more than 6 months, or if they're having severe impairment, they might do that. Yeah, they would have to have like continued issues with it. That would be the more invasive, and that's just where they relieve that pressure. Think of it, a release of pressure off the median nerve. So what am I going to do as the nurse for this patient? Overall, I want to teach the patient what is going to help to relieve or reduce their symptoms. So we talked kind of in that true or false about, devices and things that can be used. So there is splints, but there's also adaptive things. Like if my problem is I'm typing on a keyboard, and every time I'm typing on a keyboard, I'm getting these symptoms, then maybe I need a different keyboard. So they actually have what we call ergonomic keyboards that can help, where when you're typing, it relieves some of the pressure off of that nerve. A workstation modifications, or maybe changing up your body positions, doing frequent breaks. Is there another one? Yeah, no, that goes into amputations. The other thing I would say, if the last thing we could possibly do is if we need to change professions, or change the frequency of how we're doing an activity, we might look at that. But that's more extreme versus let's try everything else we can do in the meantime to try to adapt and modify in order to provide the ability for them to complete the activities and things that they want to do, and the things that they enjoy. Anyway, and or maybe they just really like their job. So yes, they want to keep their job, and they don't want to have to do a complete career change because of their carpal tunnel. So there's usually ways around it. But just keep in mind, like even if a person gets a carpal tunnel release, they can still get it in the other wrist, or they could, like, sometimes it can be both sides, sometimes it can just be one, just depends. It can still come back, or they could still have the same problem. So it's just something to keep in mind. So it's best to look at their lifestyle as a whole, use the adaptive stuff as needed, and then make sure that they are using all available treatments, least invasive first. Anyway, hope this helped. I'll see you next for amputations.